If you are over 50 and you snore, wake up tired, or feel mentally slower than you used to, this might be one of the most important videos you'll watch this year. Sleep apnea is not just about snoring. It is one of the most underdiagnosed and underestimated conditions after midlife. And it silently damages your brain, your heart, and your metabolism night after night without obvious warning signs. After age 50, the risk of obstructive sleep apnea rises sharply. Hormonal shifts reduce muscle tone in the upper airway. Testosterone and estrogen decline. Fat distribution changes, often increasing around the neck and abdomen. The tissues that keep your airway open become less stable, and what used to be just snoring can evolve into repeated airway collapse while you sleep. But the real danger is not the noise, it is oxygen deprivation. Each time your airway collapses, your oxygen levels drop. Your brain senses this as a threat and triggers a stress response. Your heart rate spikes, your blood pressure rises, stress hormones like cortisol surge. This can happen dozens or even hundreds of times per night. You may not remember these awakenings, but your nervous system does. Over months and years, this repeated stress pattern leads to chronic sympathetic activation, meaning your body remains in fight or flight mode even during the day. This contributes to persistent hypertension, increased arterial stiffness, and a higher risk of arrhythmias such as atrial fibrillation. Sleep apnea is strongly associated with coronary artery disease, stroke, heart failure, and sudden cardiac events. In fact, untreated moderate to severe sleep apnea significantly increases cardiovascular mortality. This is why cardiologists now routinely screen high-risk patients for sleep apnea. But the brain is equally vulnerable. During deep sleep, your brain activates the glymphatic system, a waste clearance mechanism that removes metabolic toxins, including beta-amyloid and tau proteins, associated with Alzheimer's disease. Fragmented sleep interrupts this process. Repeated oxygen drops increase inflammation and oxidative stress in brain tissue. Over time, this contributes to memory impairment, slower processing speed, mood instability, and increased risk of cognitive decline. Many adults over 50 assume their brain fog is just aging, when in reality it may be untreated sleep apnea. So how do you recognize it? Loud chronic snoring is a major warning sign, especially if someone has witnessed pauses in your breathing. Waking up unrefreshed after 7 or 8 hours of sleep is another red flag. Morning headaches, dry mouth, frequent nighttime urination, excessive daytime sleepiness, irritability, difficulty concentrating. These are not random symptoms. They often cluster together. If you experience 3 or more of these signs, evaluation is strongly recommended. There are also risk factors that increase suspicion. Obesity, especially central obesity, large neck circumference, high blood pressure, type 2 diabetes, family history of sleep apnea, smoking, alcohol use before bed, and chronic nasal congestion. And diagnosis is straightforward. A formal sleep study, either in-lab polysomnography or a validated home sleep test, measures airflow, oxygen levels, heart rate, and sleep stages. The key metric is the apnea-hypopnea index, which indicates how many breathing interruptions occur per hour. But diagnosis is only the beginning. Let's talk about intervention. The first and most powerful intervention is weight reduction when appropriate. Even a 5 to 10% reduction in body weight can dramatically reduce airway collapse and improve apnea severity. Visceral fat reduction specifically improves diaphragm mechanics and airway stability. The second strategy is muscle tone enhancement. The tongue and soft palate play a major role in airway collapse. Targeted myofunctional therapy, exercises designed to strengthen oropharyngeal muscles, has been shown in clinical studies to reduce apnea severity and snoring intensity. Third, nasal breathing optimization is essential. Chronic mouth breathing increases airway instability. Addressing allergies, correcting septal deviation, using saline irrigation, or consulting an ENT specialist can significantly improve airflow dynamics. Fourth, sleep position matters. Supine sleeping, lying on your back, increases gravitational airway collapse. Many mild to moderate cases improve simply by training the body to sleep on the side using positional devices. For moderate to severe sleep apnea, CPAP remains the gold standard. Continuous positive airway pressure prevents airway collapse by maintaining positive pressure throughout the night. When properly fitted and consistently used, CPAP reduces cardiovascular risk, improves daytime alertness, and restores deep sleep architecture. However, compliance is often the challenge. Alternatives include mandibular advancement devices prescribed by trained dentists, positional therapy devices, hypoglossal nerve stimulation in select patients, and surgical correction in carefully selected anatomical cases. There is also a metabolic dimension that many overlook. Sleep apnea worsens insulin resistance, and insulin resistance worsens sleep apnea. Elevated insulin promotes fat storage around the airway and increases inflammatory tone. Poor sleep further disrupts glucose regulation. Breaking this cycle requires attention to blood sugar control, resistance training, protein-rich meals, and minimizing late-night carbohydrate intake. Alcohol deserves special mention. Alcohol relaxes airway muscles and significantly worsens apnea severity. Eliminating evening alcohol alone can dramatically reduce episodes. Now let's talk about something critical: mood and mental health. Untreated sleep apnea is strongly linked to depression and anxiety. Repeated nighttime stress responses alter dopamine and serotonin pathways. Many patients are treated for mood disorders without recognizing the underlying sleep disturbance driving neurochemical imbalance. Correcting sleep apnea often improves mood stability without additional psychiatric intervention. And finally, longevity. Deep restorative sleep is when your body repairs vascular tissue, regulates immune function, balances hormones, and consolidates memory. Sleep fragmentation accelerates biological aging through inflammation, hormonal disruption, and oxidative damage. If you care about protecting your heart, preserving your memory, maintaining independence, and extending health span beyond 50, sleep apnea is not optional to address. Sleep is not passive. It is active neurological and cardiovascular repair. If you suspect you are at risk, do not ignore it. Request evaluation. Optimize weight, breathing, sleep posture, and metabolic health. Use CPAP or alternatives if indicated. Protect your airway like you protect your diet or exercise routine. Because after 50, the quality of your sleep becomes one of the strongest predictors of how well you age. And sometimes, the most powerful longevity intervention is simply breathing correctly through the night.